How's everyone doing? Dr. Erickson here, EHS Physical Therapy, Chiropractic, and
Dr. Anderson over at Essential Motion Spine Sport.
there we go. So, very important question. Okay, you see this all the time. You've been told probably one way or the other, and you're gonna have an opinion on this. Someone's gonna have shown you this, or you're gonna have seen this at some point. But should you ever, with a low back or a disc injury, should you ever bend forward like this? Can you ever, bend forward again? Can you ever use this motion? Should you ever use that motion? What's the answer?
It depends.
It depends. That's
But
right.
yes, you can use that motion for the most part.
So it's commonly there's a misunderstanding or a disbelief that you should never do that motion. It's the worst thing ever.
Yeah.
And that's because the majority of people who have that problem, that does increase their symptoms. Now, that is not for everyone. It is for some, right? So I don't live in a world, and you don't live in a world in absolutes. There's nothing that I can say that, no one should ever do that movement, because that's just not the case. Everybody's body is different. Everybody is an individual. There are different movements that are going to be right for some and are going to be wrong for others. The sheer movement of, we call this flexion in standing, meaning your spine is flexing forward while you're standing. There is great value in understanding what happens with your back pain or leg pain when you flex in standing. This tells us a lot about, is there nerve root involvement? Is there maybe an active derangement, which means that something that we can fix very quickly? Or maybe with flexing, it might be something that turns a symptom on when you're there, but then it's gone right away when you're done. And that may be like a dysfunction or a nerve tightness, an adhered nerve root, meaning you're recovered pretty well and you can do I have no pain other than when I do that, I get this tension. Well, in that case, you need to bend. You need to turn it on and do that, right? Where in other cases, if it's no, the more I bend forward, the worse it gets in the leg, then it's wrong. So you can't say that anything is, absolutely never do that. That's not, it depends on your body and your response to the movement and the load of bending and flexing. So it's actually like I said before, it's a very valuable motion for us to use. It gives us information. What else did you want to show on that one with the?
I was just going to demonstrate.
Here's the reason why. So
we'll come
in. Yeah, we'll come to you. We'll come to you. You stay right there.
So the reason, or maybe why the narrative is that you shouldn't flex, is we know that flexion can increase forces on the disc. Mm-hmm. And the most common area that you have a disc issue is that posterolateral direction, meaning backwards and it's slightly out to the side. So
which is why you only have it on one leg for the most part. It can be bilateral, but usually only one side. So that's a representation of a disc, bulge or herniation, which is what we're talking about.
And you don't necessarily even have to have this issue to have that disc pain. Nope. There can just be tears within the inside layers of that disc. So this would be the annulus on the outside here. Yep. That little middle part that bulges out.
That angular wall is kind of the dam that helps hold that stuff in there.
Yeah, but you can have little, we call them radial fissures within that, to where flexion might not be the most provocative movement, but flexion and bending, or even extension might be the most provocative movement. So it's not the same for everyone. This posterolateral direction just happens to be the most common. But even in someone that has a current issue, they're flexing throughout the day, whether you think about it or not. They're sitting down. They're bending up to get out of bed. They're going to the bathroom. All those require lumbar flexion.
Yep.
So
inherently, it's not a bad motion. It's something that we have to do to if I want to go, and pick something up off the ground, I've got a couple of choices. I can either work on, hinging from the hips, staying neutral in here, and then getting that, that flexion that way. I can work on, the full squat. But bending and flexing is not necessarily a bad thing. Now, there are times when it needs to be avoided at times.
Yeah.
And so what he's saying there, what Dr. Anderson is saying, is that it is most common with a posterior or a posterior lateral disc problem that bending forward in that way will more than likely increase your symptoms, make you worse. Yes, that's true. But we've had people that have the exact same symptoms, have the exact same diagnosis, and they required flexing that way in order to resolve that problem. The other thing that happens is this. Fear of bending because it hurts you, so now you avoid bending. As you heal, now what happens is the scar tissue back there, as you heal and it starts scarring down, now all of a sudden, we talked about that nerve root thing, when I bend, and now when I try to bend, months down the road, 6, 8, 12 months down the road, I try to bend, I feel this tightness and this tension or pull in my hamstring or my calf. Well, now I got a whole different problem.
Yeah.
Because I was so scared to bend, no one ever told me that it was okay to, to retest that, and slowly work back into it. that, I just didn't know. And so that's why that can become a different problem. What else do you want to add on that?
We can also talk about the difference between like a mechanical and a chemical pain. So in this case, in most cases, it's mechanical, meaning when you have pain when you do flex, you're putting that pressure on the disc, and then that's
it's because of movement, it's because of load,
right?
It's because of posture, it's because of repeated movements. That's why you have the pain, which means it's intermittent.
If there's chemical irritation around that nerve root, sometimes opening up that space there can give that nerve enough room to breathe and give it relief, which is a flexion movement. So it depends.
And that's the difference sometimes between flexing and standing with a nerve root tension as opposed to flexion and lying, right? So that's still flexing the low back. It's not, this part here for the spine, it's not much different for the spine is how it's moving. It's more having to do with the tension on the nerve root as opposed to, this tension here and then that there. We use both of those to determine, what direction or what movement you need to fix the problem.
And regardless, the body is a master at adapting and changing to what it needs. So even if you can't flex in the beginning, you can get back to that movement. There's absolutely no reason why you cannot flex ever again.
If someone tells you that you should never flex ever again, I'd go someplace else. Because that's not true.
You need the right coaching.
You're not going to live your life very well if you're scared to bend and never bend over to pick something up again.
You need the right coaching. You need the right loads. You need the right volumes, and that's where healthcare providers come in and play a role in helping you guide you back to flexing and flexing under load, whatever it may be. But you can get there. It's not like an absolute that you cannot.
Yeah. So the bottom line answer is, to bending and standing. Should you ever do it again? Depends. The answer is, well, you should at some point, get back to doing that. The caveat is there are times when you do want to avoid it temporarily as things are healing. But that's where Jake said that, the guidance and the coaching of someone who knows what they're doing to help you on that path. That's the important part of guiding you down that path. In general, it is not, there's no movement, and that movement, that movement is not bad. Like it's not, that's a bad movement, another one's better. It just depends on the person. It depends on the time. It depends on the healing, the phase that they're in their life. Yeah.
There's so many factors that play a role.
Don't compare yourself to somebody else going through this same problem, because they're going to be in a different phase. And maybe they're ready for it, and maybe you're not ready for it, or vice versa. So don't be afraid of the flexion and standing. It's an important movement. It gives us a lot of information that we can help guide you with. Just wanted to give some clarity on, go deeper into that rather than just saying, never do it or always do it. That doesn't give anybody any explanation as to why they hear those things. There's more layers to it. There's some depth to the answer as to why you should or shouldn't move that way. So, sounds like a good stuff.
His questions, with comments. Let us know what you think. If you have more questions, we'll do another video. This
is an important one.
We want to provide value.
This one comes up all the time.
All the time.
Bending does hurt. Increases pain for most people, but not all. Not everyone.
Yeah. So ask away.
Okay.
We'll see you next time.
Thank you.